All right, well, that seems like as good a time to start as any with that lovely intro music coming to a close. It's right at 2 o'clock, so I'll give us just like a little bit of time to let folks who might not be quite as prompt as everyone who logged in early was. Hope to have a pretty good turnout for folks attending this webinar. Really appreciate everyone tuning in and hope this is going to be some good and useful information. I guess just to get into a couple of little housekeeping things. So like during the webinar, all attendees are going to be muted and not have cameras on, but we do still absolutely welcome any and all questions. Feel free to pop those in the chat, and then at certain points I'll get to kind of a stopping point, and then my wonderful assistant Abby Sickles is on hand to help read those questions and make sure that we are getting to anything that people are not sure about. So I guess just to kick off the chat, Abby, if you want to go ahead and pop in the email and phone number for our treatment access program that I run, that'll just let people know where they can go to find the chat, and feel free to pop in and say hi, and any questions that you have throughout the presentation, go ahead and throw them in there. Yeah, so we'll go ahead and jump on into it. So this is the first of 4 webinar series that we have for PHA Live, navigating open enrollment. So this one is going to touch on mainly kind of an introductory overview of a lot of topics. So, definitely expect to see lots of stuff, things you may already know, just kind of reviewing some basics to make sure everyone's on the same page. And then we'll also dive into some, potential pitfalls, how to choose insurance plans, all that kind of stuff. So just to start out, we do want to thank our sponsors, Janssen Pharmaceutical, for their support of PHA Connects. So appreciate their making this webinar series possible for everyone. And just to introduce myself, my name is Jager Spratt, and I've been with PHA since last April 2021. I am the Advocacy and Treatment Access Program Manager, so I'm really excited to get into all this with you guys. So just to kind of start out, our goals for this presentation today, first and foremost, I want to just make sure that everyone knows what the open enrollment deadline dates are, so that no one is surprised or running out of time at the last minute. Want to make sure that everyone is understanding how different insurance coverage sources work and kind of going over the differences of those. I'll go into a bit of how to choose a health insurance plan depending on what your options are. And then lastly, covering the resources for where to turn for help, because insurance is tricky and complicated, but you don't have to do it alone. So just starting off with the basics, first off, the dates. So for this year's dates, they're pretty similar to last year. Health Insurance Marketplace, that's the individual insurance that you buy through your state marketplace. That opens on November 1st, which is a Tuesday this year. And the cutoff to get insurance that has coverage starting on January 1st is still December 15th as usual. However, this year, again, a lot of states do have extensions until January 1st or later, potentially much later, depending on your state. So if you do get it after December 15th, that just means that your insurance coverage won't kick in until a little bit later. So definitely check up on what your specific state's deadlines are and just make sure you know kind of what timeline you're looking at. And then for Medicare, this is the same date range as usual, starting on October 15th, which is next week, believe it or not. Definitely coming up soon. and then that closes on December 7th. So just a kind of a shorter window there, but make sure you do look into Medicare. If you are in, or if you enroll in a Medicare Advantage plan, then in the first 3 months of the new year, you are actually able to switch between Medicare Advantage plans, and you can also switch back from Medicare Advantage to original Medicare. So that does give you a little bit of wiggle room there. And then lastly, for commercial plans, most commonly that's going to be through like you or your spouse's employer. Those ones tend to vary based on employer, so your best bet is going to be to just check in with your HR department, or go to your insurance plan's website, whatever you need to do to figure out what those specific enrollment dates are. It does typically tend to be towards the end of the year though, so this is still definitely a great time to be thinking about this. So like I was mentioning earlier for this presentation, I'm going to start out just on the very ground level of knowledge, assuming no prior knowledge at all. I know, all of you watching this are going to know at least some parts of this information, but I just want to make sure that everyone is really starting with a very solid knowledge base. So I'll take us through a quick refresher of the basics. So starting out, basic question, what is health insurance? Basically a wager between you and the insurance company, where the company is betting they're going to take in more money in premiums than they have to pay out in benefits. So you pay a premium every month just in case something happens. You can kind of think of your premium like a monthly subscription fee for receiving and keeping your insurance coverage. So at the simplest level, insurance is basically just a contract between you and the insurance company. The insurance is going to pay a portion of your medical expenses if you get sick or hurt and have to visit a doctor's office or hospital. And then insurance companies do also pay for preventative services like annual physicals or routine vaccinations, some cancer screenings and things like that. So just some vocab before we go into different insurance options. Want to make sure that everyone is familiar with some common terms. Most basic one, obviously coverage. That's just the amount of your bill, whatever bill you're receiving for healthcare that the insurance company will pay, and under what circumstances they'll pay it. That's coverage. Each policy is going to have a different out-of-pocket cost as well. So that's going to be basically what you have to pay and not receive reimbursement for that. So there's a couple different types of expenses. We talked about the premium already. Your policy also is going to have a specific amount you have to pay for specific services. So that could either be a copayment or coinsurance. So copay would be where it's a specific set amount that you're paying for a covered service, while coinsurance would mean you're paying a set percentage of the cost of a covered product or service. So with coinsurances, that could end up being a pretty large cost if the price of the service that's being covered is very high, whereas the co-payment is going to always be that set amount. Some policies also don't cover anything until you've paid an agreed upon amount out of your pocket. That's what we call the deductible. And then some plans also have an out-of-pocket maximum or catastrophic limit for that. Once you've reached a preset out-of-pocket amount, then the plan will cover most of your remaining medical expenses for the rest of the benefit period, typically a calendar year. So we'll go into those insurance option types. It's a lot of different types, but really they can be broken down into just two main categories, public and private. It is pretty important to understand what type and source your health insurance is coming from, particularly for folks with PH, because some of the financial assistance programs out there to help with the expensive medication copays, those programs will sometimes limit their eligibility to only those with a public source of insurance, typically like Medicare or Medicaid. And then other programs like patient assistance programs for manufacturers will focus only on employer provided or individual insurance, and those with Medicare would not qualify for that type of assistance. So important to just know what you're working with. So public plans, sometimes also called public payers, government-funded programs that help you pay for your medical treatments. Each program has different eligibility requirements, and you typically have to apply for them. Medicare and Medicaid, as I had mentioned earlier, those ones are definitely the most familiar examples of public health insurance plans. There are a couple of others, but those tend to be the main ones. And then private plans, which are sometimes also called commercial plans, those are funded either by a private insurance company or by private employers. So private insurance plans tend to vary quite a lot from company to company and can even vary within companies as well. And then lastly, you might also hear the term self-funded plan. These are definitely less common, but basically self-funded plan is where an employer or union pays for healthcare expenses directly rather than contracting with a private health insurance company. So they basically become the insurer and they are the ones carrying the associated risks. So we'll go ahead and start on the public side, starting with Medicare. There is a whole lot to this plan type. And our wonderful guest speaker, Danielle Burkett, is going to be going into a whole lot more detail on Medicare in the next 2 webinars in this series. So for now, I'm just going to touch on kind of a surface level of this insurance type. So Medicare is a federal program, same across the whole country, and it provides health insurance coverage. You can receive it either by turning 65 years old. You get that regardless of your income level at the time that you reach that age. Or if you're not yet 65, then you can still receive Medicare if you become disabled. So for that, you have to apply through Social Security disability to qualify. But that is definitely a viable option. So Medicare has 4 basic parts, A, B, C, and D. And starting off with Part A, mainly just hospital or inpatient care, some related care facilities, that kind of thing. Part B is for outpatient care and also for durable medical equipment. So specific to PH, that would include things like oxygen equipment or Remodulin pumps. It's got several other things there, but those are kind of the broad, big pieces of that category. Then for Part C, that's also called Medicare Advantage, and it basically rolls what you get with original Medicare, Parts A and B, into one plan that is provided through a private health insurance company. So some Advantage plans, not all, but some do also include prescription drug coverage. So it'd be like Part D is also rolled into that Part C Medicare Advantage. So that one can be a little bit more complicated. It does still count as Medicare though. So even if you do have a private health insurance company, it's still through Medicare, and so it's still going to be counted as public insurance, not private. And then, like I mentioned, Part D, that's for prescription drug coverage. So if you don't have Medicare Advantage, then you would choose to enroll in a private prescription drug plan, Part D, to receive this coverage. So some folks with Medicare do also purchase Medicare Supplement or a Medigap policy. So that'll cover healthcare expenses that Medicare Parts A and B don't cover. Medigap policies can only be combined with original Medicare, not Medicare Advantage. And then lastly, just as a note, enrollment in Parts C and D are only allowed during approved open enrollment periods, which we just went over. Typically is from fall to winter, that October 15th to December 7th date window. So specifically Medicare with Social Security disability assistance. Social Security disability is a benefit funded by Social Security taxes, and that helps you cover medical and non-medical expenses when you're unable to work. So you are entitled to benefits if you've worked jobs that pay into Social Security, and if you have a medical condition that meets the SSA's definition of disability. Definitely is a complex process, but a lot of PH patients have successfully applied for SSD, and after being on SSD for 2 years, then you can automatically qualify for Medicare. But you do have to still apply for it, and you still have to wait those 2 years. So definitely during that 2-year gap, it's really important to make sure you've got some option for health insurance, whether that's going with COBRA or individually purchased marketplace insurance, some form there before the Medicare kicks in. And then other public insurance sources, Medicaid, I mentioned. Medicaid is actually 50 different programs, technically. They're each run by each state individually. So Medicaid is kind of the umbrella, but each state is in charge of setting like the specific guidelines, parameters, eligibility criteria, and all that. There are still federal laws that regulate what each state can and can't do, but then they have kind of their own prerogative within those boundaries. So it is there to provide health insurance coverage to low-income individuals, particularly those who are disabled, elderly, minors, or are pregnant. So Medicaid has different names in some states, and the amount of coverage and other details vary quite a lot by state. And over the past couple of years, some states have expanded Medicaid to cover all low-income individuals, but of course, not all have. So you can learn more about the specific program in your state through the State Health Insurance Assistance Program or on the Medicaid website. Then the next two, CHIP and veteran health benefits, those ones, kind of as one would assume, are specific to those groups. So CHIP, that's Child Health Insurance Programs, basically providing low-cost health insurance coverage only for children, but in families who are earning too much income to qualify for regular Medicaid, but who still can't afford to purchase private health insurance. And then on the military side, so if you've been active military, then you would be eligible for Veterans Health Care benefits, which you could find out more at the U.S. Department of Veterans Affairs.
Jager, we do have a couple of questions.
Yeah, totally.
So first, someone asked, is it true that Remodulin pumps are no longer going to be covered in Part B?
That I haven't heard about, so I would assume that that should still be Part B, but that is something to look into. So I'll definitely take a note of that, and we are going to be answering more questions later on throughout this series. So definitely figure out what the answer is for you there, and come back with an answer.
Sure. And then another question is, how do we know whether Advantage or Part D will be better for us? They're saying that medications are their biggest expense by far.
Yes, yeah, that makes perfect sense. So the short answer is that you just kind of got to do the research. It's going to depend a lot based on which specific Medicare Advantage plan and which Part D plan you're looking at, because Part D is not like a universal kind of block the way that Part A and Part B are. So you still have to like shop around for your Part D plan, even if you're on Medicare, like original Medicare. And then for Advantage, kind of same thing. There's a bunch of different plans out there. So the basic process is you have to go and find the drug formulary list and try and look at what the specific copayment costs are going to be for the drugs that you need, and just kind of cross-reference between the different plans that are available, which I will say is a lot of work. So there are some resources out there for like direct one-on-one assistance. to kind of help guide you through that. And the links to those organizations will be on a couple of slides later.
Awesome. Oh, yay, we have a lot of questions coming in. So I have a question. Who do I consult to see if it would benefit me to change from Medicare and my Medigap plan to an Advantage plan?
So again, the website, the folks at, I believe it's Pan Foundation, have a case management service that's just free to anyone with like chronic illnesses like PH. And they do a pretty good job of helping folks one-on-one figuring out those kinds of questions.
Sure. And then another question. Someone is wondering, where do I fall with insurance? They're a retired teacher due to disability and never paid into Social Security.
That would be something I would have to look into individually. I would be kind of surprised as a teacher for you to not have paid into Social Security, because my understanding at least is that that's supposed to be like a requirement for employers to just take that Social Security like tax out of your paycheck. But if that's not the case, then yeah, like I said, that would be kind of an individual thing I'd have to look into further.
Thank you. Keep sending your questions in.
Yep, appreciate it. Lots of good questions. Okay, so private and employer-based insurance. So group coverage is provided by an employer, definitely a pretty common source of health insurance. So if you have started a new job, you want to make sure that you are signing up for this as soon as possible, because there's usually a limited window where you can sign up. And if you plan or realize you're going to have to stop working and had been receiving your health plan through your employment, then you do have the option to keep your insurance coverage under COBRA, which is the Consolidated Omnibus Budget Reconciliation Act. They love their acronyms. If you elect to keep your insurance through COBRA, your group plan will transfer into an individual policy. One thing to note, though, this can get very expensive over time because you don't have an employer that's supplementing the premium. And in addition, insurers can actually charge you upwards of 110% of the premium. So it's more expensive for you than it is for your employer. So if you do stop work, you can maintain your group coverage for 18 months. You do have to notify your employer within 60 days of the qualifying event. If you leave work because you're disabled, then COBRA does give you an additional 11 months of coverage, which brings the total to 29 months, which would be, hopefully around when your Medicare kicks in if you had applied for Social Security immediately after you stopped working. And that is actually one big reason that you should apply for SSD or SSI immediately after you stop working if you think that you might be disabled for a year or more. However, that 11th month extension is not automatic. You do have to apply for it. And then on the individual side, individual coverage can be purchased directly from a health insurance company. It can also be purchased through a federal or state health insurance exchange, which would be the health insurance marketplace that I mentioned earlier. So insurance purchased through health insurance exchange is required to include a minimum level of coverage for key services, which are called essential health benefits. So these plans through the marketplace may not discriminate against individuals with pre-existing conditions and may not include annual benefit caps. Also, financial assistance might be available to help low-income individuals and families purchase insurance through a state or federal exchange. So when you're applying for health insurance through an exchange, you do also automatically get screened for Medicaid and for CHIP eligibility. So there's a lot more information about federal and state health insurance exchanges at healthcare.gov. And again, like we had mentioned, health insurance open enrollment does take place in the fall. There is also the opportunity for a special enrollment period if you lose your previous health insurance or have certain qualifying life events, typically revolving kind of around a change in family status of some kind. And one quick thing to note, when you're looking at individual plans, you definitely want to be cautious about purchasing short-term or limited duration health insurance coverage. Those plans are able to offer very low premiums, but it's for a reason. Basically, you're getting what you are paying or not paying for. So they typically will have very high deductibles or very high cost sharing requirements. So those short-term and limited duration plans are allowed to discriminate against individuals with pre-existing conditions, and they're also not required to provide the essential health benefits the way that those through the marketplace exchange, healthcare exchange, are required to. So I will go ahead and pause here if there's a couple more questions that I've filtered in.
I have one question. It's a little specific, but there's a patient who is under 65. They have Medicare Original and Supplemental Insurance, or Medigap. They've heard that if they change the supplemental insurance provider, they might be subject to medical review, which I guess means that they may not cover prior medical conditions. They're wondering if that's true. And if that is true, when can they change their Medigap provider?
That is a great question. I do not have that level of detailed knowledge about Medicare, and that is exactly why I have invited Danielle to speak with us the next 2 weeks. So we will definitely make sure we have an answer for that question, but I do not know off the top of my head right now what the answer is.
Awesome. Another question just came in that might be similar to the one that was asked earlier, but this person has been told that Remodulin pumps are covered in Part B and then need to get Plan G for costs not covered in Part B. They're asking if that's true.
So that might be like Plan G, maybe meaning Medigap, which would be basically that some services are covered in Parts A and B, or are required to be covered, but then there are some things that patients might need that are not covered, and so that's when the Medigap comes into play. So yeah, the specific details I think would require a little bit more of an individualized answer, but broadly, I guess for the Remodulin pump, I believe it should be covered under Part B, but I don't want to say that for sure because I'm not certain. Cool. I'll go ahead and dive into how to choose a healthcare plan. And definitely thanks for all the questions. Please keep them coming. And if we do get questions that I don't know the answer to, we're going to be recording all of these questions and providing them to Danielle and making sure that we have answers ready for y'all in the next 2 weeks. And then there's also the Q&A at the very end of the month on the 27th. So there will be plenty of time for answering questions. So the more that you can give us earlier, the better we can look up answers and get them back to you. All right, so for choosing coverage, healthcare plans of all kinds, as we've been talking about, have an annual open enrollment period. So that's the point at which you can add or change coverage without penalty. So this can be a really great opportunity to review what health insurance options are available to you. Even if you're not necessarily changing insurers, you can still kind of swap out different parts of it plan. So definitely a good idea to just prepare for any anticipated changes in coverage needs at this point. So in order to decide on your plan, a good method is to basically just do a lot of information gathering about your plan options and literally write it out, make a list for each plan option that's available to you. So you're going to start by listing out the medications you need and any medical care that you expect you're going to need in the upcoming year. So it includes like routine tests and hospitalizations. And then you also, so I guess once you've listed out those medications, you need to go into those plan choices, like the drug formulary that I had mentioned, and find out if the coverage is included for the prescription drugs that you need, or if you're going to need to purchase the coverage for prescription drugs separately. Also want to make sure that you're taking note of the premium or the monthly cost for each option, and find out if any of the plan options require you to pay a deductible before coverage, and if so, how much that coverage is. Then you're going to be reviewing your list of anticipated medical needs that you made and cross-reference it with the plan options to determine whether those medical needs and services are going to be covered. So like we mentioned, like if your pH medications are included on the prescription formulary, also looking into something like if there's a limit on the number of nights in the hospital the plan will cover, trying to take that into consideration. And make sure that you're taking note as you're doing all this information gathering of what portion of the cost of these items your plan will cover. Basically what your out-of-pocket responsibility will be for the medications. So for example, for each of your pH medications, are you going to be charged a set dollar amount, a copay, or are you responsible for a percentage of the drug price, so like a co-insurance, and taking into account the difference in price that's going to be. And so after you do all of that information gathering, which admittedly is a lot of homework, at that point, then you should be able to compare the total cost of plan options. So that's going to include, you want to look at both the premium, that monthly cost, as well as how much you're going to have to pay for medication copays and other expected medical service needs. As a general rule, plans with more expensive premiums tend to cover more services or to cover them at a higher rate, which can make them a better deal than lower premium plans once you take into consideration your total expected cost for the full year. And another thing to note, you definitely want to make sure you're double checking information on your pharmacy network with that particular plan. Folks with pH should definitely be paying special attention to pharmacy network because it's really important you're able to receive your medications through specific specialty pharmacies. So that can cause some challenges if the plan that you have doesn't cover the specialty pharmacy you need that carries your medication. And as I guess a bit of a side note, plans purchased on the insurance marketplace that we were just talking about, typically there's 4 categories of health insurance plans: bronze, silver, gold, and platinum. So those categories are there to show you how you and your plan are sharing costs. So the lower premiums with bronze would be correlating to higher rates of cost sharing for the patient, and vice versa with platinum that have high premiums would be lower rates of cost sharing for the patient. So those plan categories don't correlate to the quality of care that you're getting, just the cost sharing ratio. And commercial plans through employers do also tend to have kind of similar packages. It'll be a different terminology sometimes, but typically mainly the difference is going to be how much cost sharing you're responsible for. And then another little detail that you can also be taking into consideration when you're looking at your plans is the network type. So all these fun acronyms: HMO, PPO, POS, EPO. So some plans, basically what these mean is some plans allow you to use almost any doctor or healthcare facility, while other types of plans limit your choices or are going to charge you more if you use providers outside of their network. So HMO, the health maintenance organization type, is most common to individual plans, and it requires referrals for specialists, and also that you must stay in network to have services covered. If you see an out-of-network provider, then it's not covered at all. So POS stands for point of service, and that one is fairly similar. A benefit of HMO and POS plans is that there is one primary doctor managing your overall medical care. So that can result in a greater familiarity with your needs and a continuity of your medical records. And if you do choose a point of service plan and go out of network, you just want to make sure you're getting a referral from your doctor ahead of time, and that can help reduce your out-of-pocket costs, whereas you can't go out of network at all with an HMO. And then PPO, the Preferred Provider Organization, that is most common for employer-based plans, and those tend to have a bigger network of providers. And you can go out of network with this one, but the plan just is going to cover less of that service cost. In addition, for a PPO, you don't need a referral to see a specialist. That's kind of the main difference between the HMO and POS, where you do need referrals, and the PPO or EPO, where you typically won't need a referral. EPO stands for Exclusive Provider Organization. So that one does require you to stay in network the same way that an HMO does, but like I said, that does not require a referral to go see a specialist. So that's kind of the main crux of how those two differ. If you would rather see specialists without a referral, then you're probably going to be happier with either an EPO or PPO plan type. There are a couple of plans with EPOs that do require a referral, but most don't. So you just want to make sure that you're reading the fine print there. And the PPO can be better if you're living in more of a remote or rural area with limited access to doctors and care, since you may be forced to go out of network just based on what's available in your area. I know those are confusing, but hopefully that gives you kind of a broad overview of the difference of these types. So yeah, I know that's a lot of information, and it can definitely feel really overwhelming to try to do that much research into your plans, and specifically diving into like those drug formularies and figuring that kind of things out. But there are some organizations that offer assistance, like I was mentioning, including one-on-one case management. So these are some great organizations to look into, and kind of hang out on this page for a moment for folks to take note of these numbers and website addresses. I'm blanking now because the acronyms are so close, whether the PAF or PAN is the one that has the case management. I want to say it's PAN though, but both of them have some pretty good help available. This might also be a good point to pause if there's any additional questions. All right, I will keep moving on. So I'm going to get into some common insurance challenges and how to navigate them. So one kind of challenge that folks will run into with their insurance is benefit limits. So there's a couple different ways that insurers will limit the benefits that they have to pay out. Basically, this is how insurance providers can make money. They try to attract and keep their beneficiaries and then control the benefits that they have to pay out. So they can do this by excluding, which would be where the plan only covers specific services or products or providers under the plan, kind of in a similar way, of how the drug formulary works, where there's a limited list of drugs that are covered, and then they exclude coverage for the rest of them. So for example, formularies might cover Adcirca, but not Triclear. Another method that insurers use is called limiting. So that can either be a quantity limit, where your plan sets a maximum number of products or services that are subject to coverage. So a good example of this would be pulmonary rehabilitation for Medicare. Medicare generally will only cover 36 sessions of pulmonary rehabilitation, and then further sessions would not be covered. So that's how they limit that benefit. There's also cost limits. Basically, those are restrictions on the cost of services or product that the plan will cover. Then they may also use cost sharing to limit benefits, which is sort of similar but different. So this is where the copays or coinsurance would fall under this category. So cost sharing includes anything that makes the beneficiary or the patient take on part of the cost of the services. You do want to be aware of preferred or in-network versus non-preferred or out-of-network providers. So most health insurance plans will contract for a reduced rate with certain physicians and hospitals. That's basically their network. And then a lot of plans will have higher cost sharing if you get care from out-of-network provider. So kind of that's where the EPO and HMO type of plans fall under here also, is those cost sharing differences and how they manage that. So a couple of other benefit limit terms to be aware of, which I imagine folks in this community are already pretty aware, but just to go over them. Insurance companies will sometimes manage benefits to basically require a prior review before they will cover certain services. So that's prior authorization. The medical provider has to provide proof of medical need before a service is allowed to be covered. So unfortunately, a lot of pH therapies do require those prior authorizations. And then step therapy or fail first, that's a requirement that you try one medication. Typically that's something less expensive or sometimes a generic, and then have to show a documented lack of improvement before your health insurance will cover the medication that was originally prescribed by your physician. There is typically an exception process that you can follow to convince your plan to cover an excluded service, product, or provider, not just with prior auth and fail first, but just under any of those benefit limiting strategies. So your physician or provider can be a really critical resource in obtaining the exception for a benefit exclusion. And the PHA website does have more information on how to file a claim, appeal, or complaint. So make sure you check out those insurance resources on that section of our website. And then next, talking a little bit more about generics. A lot of prescription drug plans will have tiers of drugs. So again, I'm sure this is not news to a lot of folks, but just to make sure that everyone's on the same page. Health plan beneficiaries will typically have to pay more for some medications that are in higher tiers. So for like a tier 1 generic pill, you might just have a $10 copay. But then for like a tier 4 pH therapy, you might be looking at like a 20% coinsurance. So that's another way that they limit the benefits that are paid out. Definitely important to note, though, that some health insurance plans place even generic pH therapies in a really high cost sharing tier. So that's pretty important if you are currently receiving a copay card or some other kind of financial assistance, specifically from the manufacturer of your pH therapy. In those cases, if you're transitioning to a generic therapy, that's not necessarily going to result in you paying less. So it's really important in those cases that you're working with your pH team or specialty pharmacy to make sure you understand what you're actually going to have to pay out of pocket for your pH therapy. And also, again, here, as with exclusions, there's usually an exception process that you can follow to make sure that your plan will actually cover a drug or service, even if they have denied it. So your physician or provider is really critical in helping you with these cases. And just broadly, always remember that your medical team is going to be an important resource. So another area of challenge with health insurance is transitions. So that's, anytime that you're looking at a different source of health insurance for whatever reason. And if you know that you are approaching a transition, it's really important to get support and start exploring your options early. So those organizations on the previous slide, the PAN Foundation and Patient Advocate Foundation, those can be really helpful, especially if you're looking at a transition. And in addition, your PH medical team and specialty pharmacy can also potentially be helpful in those cases. And just make sure that you're keeping good records just overall is an important part of navigating healthcare challenges, and definitely especially important during transitions. So there's a couple of different kind of areas of transition. I'm happy to go into more detail if anyone has questions on these different types of transition periods. Otherwise, I can kind of keep us moving along. So just put it up in the chat if you have some questions about these. But broadly, transitions could be any gain, loss, or change of employment, a trial work period after you've been on Social Security disability, an employer change of insurance carrier, so that if your employer themselves are the ones changing the insurance company just for whatever reason. Age related, if you're turning 18, 26, or 65 years old, that's going to trigger a transition in insurance source. And then finally, family related things, marriage, divorce, retirement, or loss of a spouse who carries insurance. So I'll pause there for a moment just in case anyone's got questions on those. And I can always come back to the slide if people do have questions. So broadly, a great strategy is to just know your rights as a patient, and know that the resources that are available to you is just going to put you, one step closer to making sure that you get the treatment that you have a right to if you come across any resistance. So there's a lot of strategies here, but broadly, if your insurance company does deny a treatment or service, you definitely can make an appeal, and that initial denial is not a final decision. It can be helpful to include the Department of Insurance for your state in a appeal. So that is a regulatory agency per state that oversees and enforces state insurance laws, and they serve insurance consumers by regulating the industry practices. So if you're communicating directly with your state's Department of Insurance, it can be pretty helpful if you feel like your health insurance plan is stalling or interfering in any way with your appeal, or just generally behaving illegally in some way. You can definitely ask for help from a number of different sources. Your health plan, your hospital, doctor's office, or your specialty pharmacy frequently will have a patient advocate position that's specifically there to help you make an appeal or to communicate with your insurance company. And then lastly, this might feel like kind of a long stretch, but folks actually have had some luck with reaching out to their elected officials when they've had challenges, especially with like Medicare or Medicaid. You can definitely use your elected officials as a resource.
Jager, I do have a question that popped up.
Cool. Okay.
It says, in relationship to the previous slide, my husband is over 65 and did not take Medicare B because he was covered by my insurance. Once I retire and we both get Medicare and a Medigap plan, will he be subject to medical review due to his PH?
That is a great question. I am also not sure about that. I'm not really very familiar with when the medical review stuff gets triggered, but that is a really important thing to be on the lookout for. So we'll check in with Danielle and see if she can shed some light on medical review, because I think that sounds like a really important area that this community in particular would need some information about. Alrighty. So lastly, just wanted to touch on financial assistance, which can be kind of a big topic on its own. But broadly, as we are all aware, PH drugs can be very expensive, and definitely that's compounded if you're on medications or seeking treatment for other conditions in addition to your PH. So it can sometimes be tricky to find the right resource, but make sure you stick with your source or your search and just keep at it. So there's a couple different potential sources. First is independent organizations that provide financial assistance. these ones are the ones I was talking about generally as a Medicare or Medicaid recipient. You have to be part of those programs to be eligible. The guidelines for each fund are different though. Some of them don't require you to be Medicare or Medicaid beneficiaries. So it is worth exploring which options. And these funds open and close sporadically throughout the year. So we do our best to keep the phassociation.org/help page updated. So if the funds are open, it should say on there, and if they're not, or if they're waitlisted, we usually include that too. Then also, as I've been mentioning, the manufacturer of your drug may have a financial assistance program. These can sometimes provide copay coupons or potentially even sometimes free medication for a limited period to eligible individuals. Typically eligible is meaning people with commercial insurance through an employer. They can sometimes, some manufacturers will have broader programs that can do some for Medicare or Medicaid recipients, but typically it's a lot more limited in what they can help with. And then some specialty pharmacies may provide assistance programs or a pay what you can option for individuals, particularly if you're at risk of running out of medication. So definitely make sure you're in communication with your specialty pharmacy program. And then not as common, but sometimes your provider, like your doctor's office or the hospital, also may have a financial assistance program, or potentially have like a payment plan or can waive some fees. So definitely always worth checking in with your doctor or your care team just to see what options are there for you. And as I mentioned, definitely check out PHA's website to find out more information about those patient assistance programs and other sources. I'm also happy to talk one-on-one with folks who are looking for financial assistance and try to figure out what's going to be the best potential option for you to find assistance, and to just let you know what the current landscape of financial assistance is at any given time. So that is the end of the presentation. We'll hold these links and phone number up on the screen for a moment for anyone who wants to write these down. Can be some really useful places to start. There's a lot of information out there to take in. So again, if anyone has questions about insurance, I am happy to do what I can to answer those questions, and either now or in the future. You can always email insurance@phassociation.org. That comes directly to my inbox, so I'm happy to answer questions that way. And that phone number also comes directly to me. So anyone who has inquiries, I'm happy to share what I know, and we'll ask around if I don't know the answer. And then lastly, just as a quick reminder, we'll end where we began and just make sure everyone knows what those important open enrollment dates are. So any questions? We've only got a couple of maybe like 5-ish minutes left here before we're at the top of the hour. But definitely welcome any questions that folks want. Either I can try to answer them now, or we can pass them along to Danielle and give her some good content to bring to you guys in the next 2 weeks.
A question did just pop into the Q&A.
Awesome.
It says, are insurance companies able to change coverage of medications mid-year, or are they required to stay with the same coverage during the year?
As far as I know, they are required to stay with the same coverage during the year. So yeah, if you are having a change in coverage specifically, you should definitely have grounds to like push back on that. That shouldn't be the case. I do know I've heard of folks who have to sign up for a different Part D Medicare plan basically every year, because the drug formularies will typically like cover a APH medication for a year, and then maybe realize that it's like more expensive than they thought, or something, and then it's not covered the next year. So between years, for sure, that coverage will change, but during the year, no, it should not change. Any other questions before we wrap things up? Alrighty. Well, lastly, I do just want to thank Janssen Pharmaceuticals again for their support of this program. And thank you to everyone who joined us. Really excited to see 30 plus participants here with this webinar, and I hope folks will return next week. We've got a lot of really great information from Danielle as we dive into Medicare specific questions. And if you don't have Medicare, but you do have questions, definitely join us for the 4th installment on the 27th, because that's not going to be a specific Medicare Q&A. That's going to be broadly just any kind of open enrollment insurance type questions. So yeah, that is everything. Thank you all for joining us, and I look forward to talking with you next week.